people who are watching, non-doctors, general people who are watching, like sir said, 25-year male coming with grade 1 fatty liver. What is the natural course of this fatty liver? I mean, should he get worried or not worried is the second point. But how does he end up? When should he get investigated?
There is longitudinal population studies coming from US and Europe. Unfortunately, we don't have longitudinal population studies from India yet. But if you take a cross section of the population, just let's say 100 people with fatty liver, all comers, 100 people with fatty liver. Out of that, around 2 to 5%, depending on which race you are looking at, 2 to 5% will have MASLD. 2 to 5% will have, MASH, which is steatohepatitis. Out of 100 fatty livers, 2 to 5% have MASH. Around 30% will have MASLD, metabolic associated steatotic liver, but normal LFTs. 3 to 5% have metabolic associated fatty liver with inflammation. The majority, they just have fatty liver. Out of 100, let's say 70 just have fatty liver. They don't have anything else. So these 70, their risk of having a liver event, if you compare it to somebody without a fatty liver, if the risk is equal, the risk doesn't increase. Does that answer the question, sir? So if you have fatty liver, additionally you should have steatohepatitis, fibroinflammation, or the metabolic syndrome, or both, for you to have a liver related event. If you don't have either of these, your natural history is nothing will happen to your liver. I won't say nothing happens. Compared to general population, you are not at an increased risk of having a liver related event. So if you just have fatty liver, there's absolutely no need to panic. It can be grade 1, grade 2, doesn't matter. If you don't have the metabolic syndrome, if you don't have disturbed liver function tests, it really doesn't matter. But what is not in the guidelines is how do you monitor these people. So if you have a good lifestyle, I don't think you need any monitoring. You don't need to go back. If you have a bad lifestyle, then I think it doesn't hurt you to have repeat tests in a couple of years.